Set?
Yeah.
1 second. We're live.
Okay. We're starting with, I'm Shirley Mae Burns, and I'm a member of the League of Women Voters Elgin area and the AAUW Elgin area. I've put together this program and I hope that you find it informative. The first speaker is Janet S. Kraft. She's the Healthcare Reproductive Health Issues Specialist with the League of Women Voters of Illinois. Her years as an administrator of a community health nonprofit in a medically underserved area drew her to advocacy with the League of Women Voters Illinois Issues and Advocacy Committee. Likewise, her league experience gave her a boost in lobbying on behalf of the patients of the organization that she served. As a North Dakota school board member prior to that, she flew in on a local crop dusters plane to the state capitol to lobby for all things funding. She's a graduate of Northern Illinois University in DeKalb with an MS in Community Health, 1985. She's a registered nurse in Illinois, and she retired as president CEO of the Visiting Nurses Association Healthcare in Aurora. She was born in Brooklyn, New York, and has lived in Geneva, Illinois since 1976. She enjoys having her two sons' families at the 100-plus-year-old house on the Fox River. Janet?
All right, thank you. Well, I'm really pleased to be with you this evening, pleased to be invited, particularly because of the topic of reproductive rights. And this topic is more than timely. And we're going to hear a lot about it tonight and certainly in the months to come. I was asked to talk about how the League decides to take on an issue. And also to give you a little bit of information on what you get in your box, which is called Time for Action, when we have a bill that we are supporting. I want to back up just a little bit, well, actually quite a bit, to 1983, when the League of Women Voters of the United States adopted the policy on reproductive rights. But that was after concurrence, after agreement with all of the leagues in the country. And it only took a year to have that happen, so that's pretty good. So I will read that very brief policy that is going to be discussed tonight and also, I think, in the months to come. Public policy in a pluralistic society must affirm the constitutional right of privacy of the individual to make reproductive choices. And what really sticks in my mind are two words, the constitutional right. And I think this is what is being challenged more strongly than ever. Now, how does the League decide to take on an issue? Now, it isn't a top-down decision, and I imagine that not too long ago, the Elgin League was asked to do work on program planning for the State League for what we're going to do the next couple of years. So the individual leagues discuss what they think is most useful for league policy and action in their own communities. And that is turned into the State League, and it's really put together for a new focus for the next 2 years. And I really like very much what the State League has, how they've handled it. It's a sort of a different format. We have what are called three pillars of action for the next 2 years. And where healthcare and reproductive health comes in is this in this pillar. What it says is equitably meeting basic human needs. Now, the other two pillars are ones I don't think any of us would dispute: voting rights and climate crisis. So next, I was asked to say, once we decide what kind of issues we're going to tackle, then how do we take action? And that happens with the Issues and Advocacy Committee in the State League. And we have over 20 issue specialists who do this type of thing that I do. We're issue specialists. And I work with another issue specialist on healthcare and reproductive health, Margaret O'Hara, who lives in Chicago, and she is part of the Chicago League. So interestingly enough, we both had healthcare backgrounds, and we didn't know that before we met each other, but we're both sort of gravitated to doing healthcare and particularly reproductive health. How do we get our information when we want to make recommendations on bills that the State League should support? Well, any kind of news, whether here, our phones, or if you get a daily newspaper, excuse me. But I think one of the biggest, best ways is we're a member of a coalition on reproductive health access. And the Planned Parenthood Action is also a very active member of this coalition. And we have some 30 organizations that are part of the coalition. So it's a really great place to learn. And it is where we get some consensus on what bills are coming up. Or bills, I think that you'll hear about later, bills that haven't made it in previous sessions, but we really want to work on again. Our process with the State League is Margaret and I sort of review bills that come in, and there are many of them. And we look at ones that are consistent with our policies and ones that look as though there is sufficient support to get them moving. And I recommend them to our committee chair and to our State League president. And we have sort of a rule of thumb when we send you one of these for action. Sometime between the second and third reading of these bills. We don't want to send it to you too early to get in touch with your legislators, or too late. We don't want it to be too hot or too cold. So we try to time that, and then it's sent along to you. And if you'll notice when you get it, sort of at the bottom, they'll say, if you want to learn more about the bills, here's a link. Find your legislator's contact information. There's another link. And it suggests you get a palm card or something to put in your wallet to get their contact information. My legislators don't necessarily always agree with the bills that we're promoting, but I've found they and their staff, they really like to be contacted, and So don't hesitate, if you haven't done it before, don't hesitate to do it. And you'll always find the name of the issue specialist who did the preliminary work at the bottom. So thanks again for inviting me, and I will put a link on how to contact the issue specialist in the chat.
Thank you very much, Janet. And I want to mention, even if your legislators support the legislation, they appreciate hearing from you also, because they need those contacts,
Right.
to say that there are people that support as well as oppose. Now I'm going to turn it over to Rianne Hawkins, who is the Director of Advocacy and Campaigns for Planned Parenthood of Illinois and Planned Parenthood Illinois Action. In her work, she plans and coordinates efforts to motivate, activate, and build support for Planned Parenthood and partner initiatives. Since joining Planned Parenthood in 2016, Rianne has been involved with the efforts to pass a number of reproductive health care initiatives, including the passage of the Reproductive Health Care and the passage of the Equal Rights Amendment, both of which were done in close collaboration with the League of Women Voters of Illinois. Rianne also is an active member of the League of Women Voters of the Springfield area, having served as its first president. In addition, she has also served on the statewide nominating committee for the League of Women Voters of Illinois. Rianne lives in Springfield with her husband, Neil, and 2 children, Hazel and Walter. Rianne.
Thanks so much, Shirley May, and thank you to Janet too, and thank you to Bree, who you're going to hear from in just a moment as well, with our partners with the Illinois Caucus on Adolescent Health, strong supporters of all the work that we do around reproductive rights. I'm going to share my screen so you can look at my handy dandy PowerPoint presentation. So hopefully this works. All right.
I see it.
Can everybody see that? Oh, and then I messed it up. My apologies. Okay. So I was asked to talk about the current state of reproductive rights in Illinois, and thank you to the League of Elgin for inviting me to do this. So in recent years, we've seen a lot of attacks and amplification of attacks on reproductive rights throughout the country. We've seen more and more state-level laws specifically designed to restrict bodily autonomy. I'll touch about those a little bit later in the presentation. These laws were also specifically designed to directly challenge the Roe versus Wade decision. It's like these Republican legislators or these anti-choice legislatures are racing to be the ones that actually overturn the Roe v. Wade decision. I work in a health center. I work out of our Springfield Health Center, and I can tell you firsthand that we've also seen an increase in violence and threats towards abortion providers throughout the state of Illinois. And it's not just in hostile states, it's happening here in Illinois as well. Let's see here. But even with all of that, abortion rights still remain very popular. I'll give you a couple of minutes to read through this, but I'll give you the top line summary. Overall, people support a person's right to receive a safe and legal abortion. 6 in 10 adults, or 59%, believe that abortion should be legal in all or most cases in this country. And most people do not believe that the Roe versus Wade decision needs to be overturned. 70% of adults believe that, and that's more people than that we've ever seen in studies support the Roe decision. And those surveys were done just recently within the last couple of months by the Pew Research Center and the Gallup research as well. But attempts to ban abortion still persist. Politicians still insist on enacting these abortion bans, and they do it through a couple of different methods. The first one is through the targeted restriction on abortion providers, are known as TRAP laws. These are laws specifically designed to not directly outlaw an abortion in a state, but to make it very difficult to obtain one. I'm sure that some of you saw our neighbors just to the south in Missouri, saw this firsthand, where there was a very hard fought battle to keep the last remaining abortion provider, which happens to be a Planned Parenthood affiliate, open in Missouri. They were going after that provider based on administrative requirements for that facility, not necessarily after the right specifically to obtain an abortion. So we're seeing that kind of nibble around the edges kind of work. The Texas law, which just passed a few weeks ago and actually will go into effect on September 1st, is a brand new front in this fight. This spring, the Texas legislature banned a near total ban on abortion in the state of Texas. But in addition to the ban, which is a 6-week ban, which is before most women even know that they are pregnant, in addition to that, they added a provision that allows anybody to sue someone for obtaining an abortion, helping someone to obtain an abortion. You can sue. You don't have to be directly involved in the person's healthcare in any way, shape, or form. You can be a neighbor. You can be someone with just knowledge of the situation. You could be a casual observer. And this could potentially open up if somebody travels from Texas to another state to obtain an abortion. The other state or the provider in the other state might actually be liable as well. So it's a brand new way to look at this law and to try to ban abortion. And I'm sure most of you saw this just this week. Planned Parenthood, with a coalition of providers, along with the ACLU and many, many others, are directly challenging this law. We knew it would come down to the courts, and that's exactly what's happening. And we've started that process just this last week, or just this week, I should say. So even though the Texas law is being challenged, there's also an additional Supreme Court case that's out there too, 2 separate cases, potentially with the same goal, and that is to ultimately overturn the Roe v. Wade decision. But this summer, the Supreme Court announced that they would be taking the case of Dobbs versus Jackson Women's Health. And this is the case that most people are saying could directly overturn the Roe v. Wade decision. In May, they decided to take up this to deal with a challenge on Mississippi's abortion ban. This is the first time that the 6-3 court, 6 anti-choice, 3 pro-choice members will be taking up an abortion rights case. It's widely considered that the justices will use this case to do one of 2 things. Either they will slowly chip away at Roe and look strictly at the legal question in the case, or they will use it to overturn Roe completely. Oral arguments will be heard sometime in October of this year, but a decision isn't expected until January, and maybe even a little bit later than that. So this is not going to happen immediately. This is going to be something that's simmering in the back for at least 6 more months, if not longer. The Roe versus Wade decision is the legal framework that kept abortion rights legal here in the state of Illinois. But I need to point out that Roe versus Wade is not a reality for many people throughout parts of the country, and for many people even in the state of Illinois. Barriers such as restrictive laws, having to travel miles away from your home, and being able to afford the procedure in and of itself has always stood in the way of people obtaining safe and legal abortions. So this case, while very important, I think we also need to recognize the fact that this reality does not exist for many people still in this country. In Illinois, we saw this coming, I have to say, and so we prepared. We are definitely prepping for a post-Roe world. We worked in coalition to cement reproductive rights in the state of Illinois. This began with the very high-profile campaign in 2017 to pass a bill known as HB 40. HB 40 repealed the trigger language that existed in Illinois state law. And basically we had language in our law that said if the Roe v. Wade decision was ever overturned, then Illinois would become an anti-choice state immediately. We repealed that language with this law. It also expanded coverage of abortion to include those that are on Medicaid. So removing that barrier for people that could not afford the procedure due to financial circumstances. We helped to expand coverage for those that rely on Medicaid for their health care. And then in 2019, we worked together to pass the Reproductive Health Act. This was a very expansive bill. It removed all the problematic language that was left over in state law around abortion. So for example, we had in our Illinois state law that you had to have the consent of your partner before you were able to obtain an abortion. Not, stuff that just was not good. And so we swept all that away. And then we also affirmed Illinois as a pro-choice state, even if the Roe v. Wade decision has been overturned. I also would be remiss if I didn't mention the good work that's also being done by our partners at the Chicago Abortion Fund, groups like the Chicago Abortion Fund and the Midwest Access Project, and many, many more. These are only two of them that are helping day-to-day people obtain a safe and legal abortion here in the state of Illinois. They do amazing work and work with individual patients and do things like arrange childcare, arrange for overnight stays if necessary, in addition to financial support for the procedure itself. So these people are on the ground every day doing the work to make sure that people are able to get to Illinois, and that once they're here, they're able to obtain the medical services that they need. But there is a lot more work to do. Making sure that the progress that we have made on this issue is going to be an ongoing project. We can't rest on our laurels and think because the laws have passed that everything will be fine in the state of Illinois. We're always one election away from that not being the case. And trust me, our opponents are waiting for that day. They always introduce bills in the General Assembly to overturn things like the Reproductive Health Act. So they are just waiting for their chance. So making sure that we always have a pro-choice General Assembly is very important. We also have a duty being in the Midwest to expand those rights and to make sure that they are available to everyone. And that is why it's so important for us to continue the work and to repeal the harmful parental notice of abortion law. I am going to stop sharing my screen because I want to introduce my friend Bree Garrett, who is the digital organizer for our partners and actual leaders in the Repeal PNA campaign, the Illinois Caucus on Adolescent Health. Bree, if you want to go ahead and take it over from me, I know your passion about this issue will be very well received with everyone.
Thank you so much, Rianne. Amazing introduction. Thanks everyone for inviting me here. Yeah, so as Rianne mentioned, Roe v. Wade cannot be the end all be all for abortion access because as we've seen, it's not. When laws like PNA or the Parental Notice of Abortion Act exist, it gives justification to reverse legalized abortion and to determine who has the right to their own bodily autonomy. As the digital organizer for ICA, I've been advocating for repealing the PNA law for a few years. When I first started at ICA, it was like 2017-ish, 2018-ish. But
Excuse me, Bree. Would you
yes.
say what the PNA law is for those that may not know?
Yes, I'm about to get to that. So the PNA law is a law that requires a young person under the age of 18's parental guardian or like legal guardian, saying that in quotes because that's also kind of problematic language, to be notified within 48 hours before a young person gets an abortion. So the medical provider has to alert the guardian that the person is receiving an abortion. It's been kind of on the books since 2013, and ICA has been working to repeal that law since then. As a law, not only is it an invasion of a young person's privacy and bodily autonomy, it's also redundant and counterproductive. Statistically, young people notify the person or people they trust when they are getting or considering getting an abortion. This doesn't always look like a parent or guardian for various reasons, and this law lacks the range to acknowledge that. But when young people go to a parent or guardian and they do it willingly, it's because they know that they can. And when they know that they can, then they don't need a law like PNA to force it. So then the question becomes, who is this law for? Or rather, who is it against? And the answer is the young people who legislators and adults are more interested in controlling than they are helping. PNA is an attempt to ban abortions for some of the most vulnerable without having to say the word ban, because there remains a stigma around abortions and a specific people who is susceptible to advocate reproductive justice for. It's irresponsible and incompetent to shame and disregard young people who are pregnant, young people who are parenting, and young people seeking abortion care. It's proof that not only are young people, in regards to our legal system, only really seen for the sake of stigmatizing and stereotypes, but also that they keep going unheard, as if people are supposed to remain powerless until they turn 18, and as if that establishes a healthy foundation or relationship with power. Someone cannot claim to be pro-choice if they are not also actively advocating for young people to have all the resources they need to be safe, affirmed, and healthy. This means providing tools and making gender/queer inclusive, shame and stigma-free, pro-Black and brown healthcare and education in schools, in homes, in doctors' offices, everywhere. And this also means repealing PNA. And I am happy to talk further about PNA if folks have any more questions. But that's the statement that I have. And you can, thank you so much, Brian. You can take action to support the repeal of PNA. We have a website called repealpna.org. And at the moment, legislators have decided to not move forward in this current session or the current section that we were in, partially because there were, from our understanding, there were folks feeling, I guess, like iffy on wanting to repeal a law where the people who are mainly affected are folks who cannot vote for them, which again, problematic, right? Like, it's not fair to assume that because someone is under the age of 18 and legally can't vote, that they don't deserve like bodily autonomy or deserve the right to have a say really in like their own body, in their own healthcare, and their own like lives. So it seems like what folks, what a lot of like legislators are looking for are having or hearing more from like parents and hearing more from adults about their thoughts on repealing PNA, but also as a youth organization, like one of the things that we are very interested in is bridging this gap, I guess, with how like adults look at this issue and are talking about this issue and are in support, and also how we have like young people being like empowered and not just being used as like poster childs for trauma or poster childs for like, this is how you're saving young people, right? Like the goal is to be able to have like young people and adults be able to come together for this law and for repealing this law, and to also like allow young folks to be the voice of the movement. And yeah, whoever's next, passing to them.
Thank you, Bree. Regina or Rianne, did you have something more?
Yeah, I just wanted to point out two quick things. Bree, you did a fantastic job as always. Thank you very much for breaking it down to everybody. Two additional things that I just want to mention about the repeal of the Parental Notice of Abortion Act. Number one, a young person is able to make literally every decision around their pregnancy, whether or not to adopt, whether or not to have a C-section, whether or not to receive those tests. Every single decision they have around that pregnancy is theirs and theirs alone, except for the choice to have an abortion. That's it. So I think, that in and of itself, I think speaks volumes. The other thing that I will mention is there is a process with the Parental Notice of Abortion Act for a young person to do what's known as a judicial bypass. And we can get into this a little bit further, but it involves, at its basic levels, it involves a young person appearing before a judge. And this, you know, you see a judge on Law and Order, right? Like the person's done something bad. The person hasn't done anything bad and should not have to go through the legal system in order to obtain, you know, something that is their constitutional right and a safe medical procedure that they have a constitutional right to obtain. So just want to make those two quick points. There's a lot going on around reproductive rights right now. We've got the Texas law that's simmering out there that there's probably going to be a court case. We've got the Supreme Court, the Dobbs v. Jackson's Women's Health case that's going to be heard in October. There's also the federal budget, the proposed federal budget this year is the first time that has not included what is known as the Hyde Amendment. And the Hyde Amendment is a policy that was first enacted by, I'm not sure if he represented Elgin or not, but Congressman Henry Hyde from suburban Chicago made it a point to put that no taxpayer money would ever go to fund abortion care. This is the first time that the federal budget has not included that policy. So leveling the playing field, basically allowing for abortion access to people that might struggle or might be financially disadvantaged to be able to obtain what is their constitutional right anyway. It gets back to that Roe being not a reality for everyone. It's a small way that we can help hopefully level the playing field. So lots going on in the reproductive rights space. I definitely encourage you to get involved with the Repeal PNA campaign, because that is Illinois. That is here in our backyard, in our home area. And Bree and everyone, Elisa, everyone over at ICA and NAPA, which is the Asian American Women's Forum, have been doing just yeoman's work to get out the word, to spread awareness, and hopefully Bree has motivated you all tonight to help take action to repeal this law, because it's going to take all of us, for sure.
Thank you very much, Rianne. Do any people in the audience have a question that they'd like to ask one of our speakers? Well, I'll ask Rianne, can we get a copy? Can you send a copy of your PowerPoint to me and I can forward it to anyone who wants it?
I would be more than happy to. Absolutely.
Great.
Yeah.
I think
Shirley, may I just unmuted myself so that I could ask a question, because I don't think you saw my hand.
No.
And this is for any of the panelists. Do we have numbers in Illinois? Do we know how many abortions occur every year? Do we know how many of those are under 18? Do we have any numbers of any kind?
There are, I must admit, I was not prepared with those numbers for tonight. I do know they exist. They're through the Health and Human Services, I think, the Illinois Department of Health and Human Services. Yeah.
Anyone else? You'll have to speak up because I don't see all of you right now. Well,
Rianne, I'd like to make a comment on the parental notice. I'm not sure how many take advantage of it, but I think ACLU had a program to work with, young people young women who wanted to go the judicial route, because there's no other way they could do it. So I think that's still in effect. I can't see Rianne, but
yeah, I'm here. Hey, Janet. Bree, I don't know if Bree, I don't know if you want to take this. This is about the Judicial Bypass Project. Yeah, go ahead.
Yeah, I can take it. So there is, I guess I'll speak first about what judicial bypass is for folks who may be unsure, but the judicial bypass process essentially is a way for young folks to get like I guess I'll say like a waiver to like avoid having like their parent or guardian be notified about them receiving an abortion. So what happens is that they have to go before a judge and basically plead their case of why they are capable of receiving an abortion without having an adult or without having like a legal guardian be involved in the process. And like, I guess, so we aren't, as an organization, we aren't saying like folks shouldn't do judicial bypass, right? But we are saying that it's also another barrier. It's also another harmful thing. And it's also like kind of condescending because it's requiring folks to have to go before a judge and basically plead sometimes like traumatic events, but also just like the feeling of being inside of a courtroom, having to talk to a judge, having to get a lawyer, and also on top of like, if someone's a student, right, they have to figure out to go to these meetings or go to this courtroom while like in school. Maybe they have a job, maybe they don't have a car. They have to do all this without like their parent or their guardian knowing that it's all happening. And also just speaking before like a judge, like I know adults who, when they have like a traffic ticket or like, I don't want to go to a courtroom, like imagine having to go to a courtroom to plead like about like getting an abortion, right? Like that is, in a way, to me, that feels like a way of like criminalizing abortion care. Yeah. But yes, judicial bypass is an option for now, but it's not like the most ideal option. And folks who I've talked with as we do, I've done like Icogram Lives, which is just an Instagram live where I interview folks. And someone that I interviewed from Jane's Due Process in Texas talked about having to navigate getting a judicial bypass in order for them to receive an abortion when they were young. And like, even they admitted like part of the process is that it also kind of like delays someone getting an abortion sometimes. Like sometimes they go in to try to have like their process and talk to the judge and it gets canceled and they have to come back like weeks later, or they have to figure out like their case and stuff. And when we have folks trying to decide or trying to force abortions to be delayed, like it's a time sensitive thing. Like we can't just have folks having to like wait until they have like enough information in quotes before they can decide that someone can get an abortion. Like it's not the safest route.
Yeah. No, I agree. It's not ideal, but you know, the last I knew, ACLU was, you know, if that was the only way they could do it, they were helping. But I don't know, maybe, you know, I heard at one point that there were almost every you know, application to go that route, that the judges, you know, gave them the waiver. I mean, it was, you know, I don't think it was easy for them to do, but I think it does show that the reasons that they had, you know, as far as, you know, abuse or, you know, that they just really couldn't safely tell anyone in their home. So I was just, I think I would guess during the pandemic, it made it doubly hard to even attempt that.
Rianne, do you have any information on the ACLU efforts?
Yeah, Janet, you're absolutely right. I don't know the exact percentage, but it's over 90% of all judicial passes are approved. Yeah. So that means over 90% of the people that appear before a judge obtain their judicial bypass and are able to obtain a safe and legal abortion. Now, this does not obviously capture the people that do not feel comfortable going through that judicial bypass program. And we don't know what we don't know. We don't know if there are people out there that, you know, the situation is dire. Maybe they've tried other means. Maybe they're traveling to other states. So we don't know what's happening with people that are not going through the judicial bypass project. So, yeah. I will say it's not, I'll echo Bree, it's not an ideal situation.
Well, I'm not recommending it, but I thought it was the fact, I did hear, understand that there was a very big percentage that they got, the waiver. So their situation, it would have been, dangerous for them to tell someone in their home.
Especially when it's abuse.
Yeah.
I do want to name to Janet's point, right? Like if we have these statistics, and again, also to Rianne's point, like we don't have like completely accurate statistics because we don't know what we don't know.
Right.
If there's like the majority, like over like 90% of folks who do go before a judge for judicial bypass do get like this approval, like is that not proof then that there's like really no point then to cause a barrier and to kind of, I think in my opinion, intimidate young folks around like abortion care, right? Like it's kind of going like, how badly do they really want this? Which is like, it's problematic, and it's also like, it's very harmful. And again, like, if Emily was here, I'm pretty sure she could speak to it, Emily of the ACLU, but she's mentioned many times before that like a lot of judges and a lot of folks that represent these young people going through the process have like said time and time again that when they talk to them about like, hey, why do you need this abortion, or why are you considering getting an abortion? They've already thought through this. They've already like done like the math or the numbers and been like, okay, what was the best option for me? Because there are some young people who are like, I'm going to choose to parent, and they carry the pregnancy to term, they parent, and they do like a good job, or they do like the best job that they can as a young person in a system that does not value like teen pregnancy either. Like we are in a system that doesn't value teen pregnancy, that doesn't value teen parenthood, and that also doesn't value young folks getting an abortion. And it's like, it's a lose-lose on all of these forms. And young people are just doing the very best that they can. I feel like the thing that folks who are over 18, our job to do is to try and make that better and try and make that as helpful as possible. Because I remember when I was under 18 and like, it was not, in general, it was not ideal, but to imagine having to like go through all these systems that are purposely trying to like oppress me and harm me, which, I mean, I already have to deal with oppression, but having to deal with oppression in that format, like it's hard. Like I imagine it's very, very hard and very traumatic. Yes.
Thank you.
Thank you. Are there any other questions? Well, if not, I thank Rianne and Bree and Janet for being with us this evening, and thank you very much. I think it was a very informative program.
Yeah, thank you.
Thank you.
Yes, definitely. Thank you. It was great.
And definitely check out repealpna.org for more information on how you get involved with the whole campaign, and we would love to have all your help. So please check out that website.
Thank you.
Thank you, Shirley May.
Thank you.
You're welcome. Good night.
Bye.
Good night. Thank you.
Thanks. Enjoy the rest of your day, y'all.